Most people think when we talk of health, they just think of medicines. They think that is health. But it's much more than that. What we have seen today, firstly at Natfarm Warehouse, and then here at Salim Gabe Central Hospital, speaks volumes. The 450 kilowatt solar system powering the warehouse at Natfarm and the state-of-the-art incinerator that we have just seen here are not just projects. They are milestones in our journey toward a resilient and sustainable health system. Today we are witnessing the support infrastructure that is required to keep the system oiled and to make sure that health delivery system is complete.
Dear friends, this afternoon has been a wonderful opportunity to tour the facilities both at Natfarm and indeed of Sally Mugabe Hospital to see the impact that is being had on so many different lives of real investment in people. But crucially, it is also an important opportunity to celebrate another infrastructural journey. An infrastructural journey that lots of people don't see, but goes to the very real essence of what providing safe, sustainable healthcare means. An incinerator that will absolutely play a real and serious role within the operation of the health system here in Zimbabwe and beyond.
Today we were able to see health at community level where patients are dignified, where they don't have to go to the big hospitals in the capital, but they get what they need in the regional hospitals.
I am very happy to be visiting the Chibutu District Hospital. Behind me is one of the over 1,000 solarized facilities that the Global Fund's investments have facilitated in Zimbabwe. And I'm very proud to be really meeting for the first time one of the results and seeing the impact of what the partnership with the Global Fund and UNDP with the Ministry of Health and Childcare and the so many stakeholders in country has achieved.
In Zimbabwe, you see the power of partnership. What UNDP has achieved with the government of Zimbabwe is extraordinary.
Thanks to this partnership, we have solarized over 1,000 health facilities, expanded electronic patient management systems, and retained thousands of health workers, all while making meaningful strides towards our HIV, TB, and malaria goals.
Since our initial involvement in the foundation of the Global Fund, Ireland has contributed $400 million to that fund, and indeed we look forward to making our annual contribution later in this year, and that commitment will continue not just to the work of Global Fund but so many important partners that are thankfully represented here today and who are active here in Zimbabwe.
What I see in Zimbabwe is extraordinary. I think there is still a lot to be done, but we need to start to celebrate what we've achieved in this country. Thank you to UNDP, but thank you to the country team of Zimbabwe for all of the amazing work that you do on a daily basis.
There are opportunities for us to share good experiences with other African countries, and also on the Solar for Health. We've gotten more than 8 countries that are coming to Zimbabwe to understudy this, among them Nigeria, Malawi, Mozambique, and several others.
This is one of the few countries in Africa and across the world that has reached the 95 targets, and we need to make sure that we take the country to the finish line in terms of the fight against HIV.
As we look ahead to Grand Cycle 8 and the next Global Fund replenishment, we do so with optimism, but also with a clear understanding of the shifting global financing landscape. Zimbabwe is committed to increasing domestic health investments, but continued partnership and solidarity remain crucial to protecting the gains we have made and reaching the most vulnerable. To Global Fund, to all our development partners, thank you for walking this journey with us.